We respectfully acknowledge that the Windsor Regional Hospital occupies the traditional, ancestral, and contemporary lands of the Niswi, Ishkwiden, Anishinaabeg, the Three Fires Confederacy, Ojibwe, Odawa, and Potawatomi. We acknowledge the land and the surrounding waters for sustaining us, and we are committed to protecting and restoring these lands and waters from environmental degradation.
Good evening, everybody. Welcome to the October 7th Board of Directors meeting. I'm going to call the meeting to order. Do we have any declarations of conflict of interest? Seeing none, wonderful. Can I get a motion to approve the previous minutes? We have Paul Lachance, seconded by Patty France. Thank you. Questions or comments with regards to those minutes? Seeing none, all in favor? Perfect, thank you. I just have a few opening remarks. First, I'd just like to send our deepest condolences to Michael Ray's family. Mike unfortunately passed away today. Mike was a lawyer in town. He was a member of provincial parliament. He was a family man. He also served on numerous committees at the hospital. He also served as board chair in 2009 through 2011, and actually served on committees from 2004 to 2013. So again, our deepest condolences to his family and his friends. Mike was a true leader in our community. So thank you for lending him to us for all those years. The second thing I'd like to bring up is we had a lovely letter from the Ontario Renal Association, just thanking our renal program for all the hard work that they've completed in the last year and a half during COVID. And they actually called out a specific member by name, and that is Kristen Mayu. So Kristen, for all your hard work, thank you. And that I see Jonathan Foster smiling here. It's his team that does such great work over there, keeping everything moving smoothly. So Jonathan, that kudos goes to you and your whole team. So thank you on behalf of the board. Lastly, I just want to say a big shout out to Super Ethan Steps. So Ethan is in Kingsville. He was diagnosed with cancer in 2014 at the age of 2. Ethan and his parents, Nicole and Charlie, raised $8,000 this year for the pediatric oncology unit. Just amazing what this young man and his parents have done this year. So congratulations, Ethan and your parents. Thanks, and looking forward to many, many more years of fundraising from you. So keep up the good work. With that, I'm going to move it over to David for the report of the President and CEO. Thanks.
Thank you, Mr. Chair. And Mike Ray was my first full board chair of Windsor Regional Hospital. And I know Mike would want me to share this story. Is when he came in, Mike was Mike. And I knew of him before he was board chair, of course, but I didn't know him personally, and got to work with him very closely as board chair. And when Mike came in, he was adamant that he was going to not only going to help Windsor Regional Hospital in our community, of course, but he was going to reform the whole healthcare system. So he wanted some help to do that. So I had a stack of books in my office that I had read previously, and also a bunch of materials from our own hospital operations, et cetera. And I tried to put it in a concise format for him, but it was a pretty good stack of stuff. And he came in one time and I gave him the stack. And of course, we, regular conversations, ongoing conversations. And it was about 3 months after, he walked back into my office with the whole stack and put it on my desk and said, "You know what? You're doing great. Keep going. You're going to do fine. You've got a great team. Let's do this together." Because he, in a very quick period of time, unfortunately realized healthcare in his history too. It's a big beast, no matter which jurisdiction you're in, let alone Ontario, across the world. But I'm going to miss Mike, and going to miss his stories, and I'm going to miss his leadership, definitely. But he leaves a legacy behind. So prayers to Mike, of course, and his family for everything he's done for our community and for Windsor Regional Hospital, of course. So on that note, I'll start with my presentation, and I'll have some help from Dr. Saad as well as Karen Riddell. You guys good? You can see that? Thumbs up, Anthony. Beautiful. Thank you. So today's announcement, I just want to summarize it. I don't want to go too deep into it because we've already talked about it today at some length. But we have 4,218 employees and professional staff, and that's the breakdown. What we're really proud of is the fact that 98.5% of the staff are fully vaccinated or are currently following the policy, and will be fully vaccinated very shortly. So that's an amazing statistic when you think about it, an amazing number of staff. And if you want to break that down, 99% of our nurses, which are registered nurses, registered practical nurses, and nurse practitioners, are following the policy. 99% of our professional staff, which is our physicians, dentists, midwives, and some nurse practitioners, are following the policy. That's staggering. That's an amazing number. And we are filled with a building of leaders who are leading by example for our community. And I just want to say thank you to all of them. The last 2 years have not been easy for any of them, including individuals in our community. And I just want to emphasize, and I'll even ask Anthony for some help on this because he's been shared most of these, is the positive feedback we've received from our community, even outside of Ontario, actually, from as far away as BC, has been staggering from a point of view of thanking us and sharing their own personal stories of how coming into the hospital is very stressful for stressful for pretty much everybody if you're coming into a hospital. And we have a lot of immune compromised patients coming in, especially to Windsor Regional Hospital because of a lot of the programs we have. We've had a rather high incident rate of COVID in our community for quite some time, even going back to wave number 1. And just that they're not relaxing their guard, they're not dropping their guard, but the comfort they have knowing and appreciation that our staff are following this policy, and that it doesn't totally eliminate the risk, but it greatly reduces the risk in a very risk-centered building and facility for high-risk patients and fellow staff even. So we've had staff who have indicated too their appreciation that they have loved ones at home that are at high risk, and how they have tried to do everything they can, not only here wearing proper PPE, but getting vaccinated, et cetera, and using those layers, as we've talked about in the past, to protect themselves and their loved ones, and how this adds another layer of protection to them, clearly a big layer, and how they appreciate it. So I don't know, Anthony, if you wanted to add anything to that, because you've heard a lot of the messages, I read a lot of the emails.
I think the other thing that really stood out is the fact that we've had organizations come forward and say, you know what, your policy has made it easier for us to implement the same policy. It's a science-based approach. And these organizations said, you know, without the leadership of Windsor Regional Hospital, we don't think this policy would have been able to move forward at these locations without our leadership. And these two facilities that I'm speaking of deal with vulnerable people. So we are doing our best to protect vulnerable people within our walls, within our community. Please remember, it's not about the number of deaths. It's not. It's about severe illness. It's about passing it on to somebody else that could end up with a debilitating lung disorder. We don't know, but at the end of the day, this is a science-based approach. Vaccines work, and vaccination mandates work. Look at our numbers, and thank you to every one of those 99% of people, the 98.5% of people. We appreciate everything that you've done for us and the community.
Thank you, Anthony. So I'll now pass it over to Dr. Saad, who will kind of go through the next 3 slides.
Thank you, David. This is the provincial trends for COVID-19 positive with the 7-day moving average. And what you'll notice is from September 18th to right up until yesterday, you will notice a daily trend that's going downwards. This is a very reassuring sign. This is telling us that our healthcare resources are being protected, because the less number of positives that you have, the less number of people that are eventually going to require hospital care and potentially ICU care. And when you see numbers drop like this, it means a couple of things. It means, number one, that public health measures are taking effect and they are working, although again, we've had public health measures in place a while ago. Number two, the rate of vaccinations are going up. So the more vaccinated people you have, the less easy it is for the virus to transmit. And so you're stopping the chain of transmission as it goes. And as both David and Anthony alluded to, vaccine mandates that are starting to take effect and would have taken effect somewhere around September 22nd, you can see the sharp decline in those numbers. So we know not only do vaccinations work, vaccine mandates work, you're limiting the exposure that the virus can have to potential hosts, and the numbers are going down significantly, which is very reassuring in terms of protecting healthcare resources ultimately, because that's what's going to end up leading to reopening of the economy and schools and everything else. So this is a very positive trend. The cases that we're seeing based on vaccination status is divided, and now the ministry as well as Windsor Regional Hospital keeps track of patients who are fully vaccinated, which is defined as 14 days after your second dose, patients who are partially vaccinated, or those that have not received a single dose of a vaccine. And if you look at the top graph, the dark purple, you can see that the unvaccinated cases are the vast majority in terms of the 7-day average rate per 100,000. And you'll see that at the very bottom, the light green, which is the fully vaccinated, very low rates and very stable. What's interesting is the partially vaccinated curve. And if you'll notice, the partially vaccinated curve is somewhere in the middle and maybe even closer to that unvaccinated curve, which is something that's very unique compared to the initial part of the pandemic. In the first wave, the Alpha variant and the original wild type, vaccinations, even partial vaccination, was actually quite effective at preventing infection. That unvaccinated, or sorry, partially vaccinated curve would have been much closer to the fully vaccinated curve. But what we're seeing with Delta is that not even one dose is enough to protect you adequately enough. And you're still seeing quite significant numbers of patients becoming infected despite having that partial protection or starting their vaccine series, which is why it's critically important that people complete the vaccine series and are 14 days clear of their second dose in order to have full protection against the Delta variant in particular. And these are the hospitalizations by vaccine status. As I mentioned, not only does the province track these numbers, we track them as well locally at Windsor Regional Hospital. You can see from the hospitalization, general hospitalization graph that, again, the vast majority are unvaccinated. There are some that are partially vaccinated, and then you still have a minority that are fully vaccinated. But the more important number and the more important graph to look at and focus on is that of ICU capacity, because we know that even if our hospitals are getting filled up with COVID patients in regular beds, it still will not put a strain on the system to the point where you would have to shut down or the economy and go to lockdowns unless your ICU capacity is affected. And you can see here the vast majority, over 75% of patients in Ontario ICUs are unvaccinated, and 93% of them in total are either unvaccinated or partially vaccinated. Again, because of how virulent and transmissible the Delta variant is, and speaks to the importance of making sure that everybody is fully vaccinated to keep them from getting infected, to keep them from becoming hospitalized, and most importantly, to keep them out of ICU and to prevent death, which is the main reason for the vaccination program.
Thank you, Dr. Saad. I want to highlight one.
David, can I just ask, can I just say one thing? And
Yes.
Dr. Saad, what are the numbers? So it's about 80% of the population is vaccinated, maybe like 18% is not vaccinated and 2% is partially vaccinated, just to give some clarity to these numbers in the ICU, because when you look at it, it doesn't really give you that full picture of how many people are actually in each of these groups.
Right, yeah. So if you're looking at a general population, you're right. With the total completely vaccinated population is in that range. So if you look at 80% of the population being fully vaccinated, but only representing 7% of the ICU admissions, that's quite remarkable. And then when you look at the, let's say, less than 20% of the general population that is not protected, whether that's unvaccinated or partially vaccinated, they are filling up and representing 93% of the ICU capacity. So it is quite remarkable and a clear signal that being unvaccinated, it significantly increases your risk of ending up in an ICU.
Perfect, thank you.
Yeah. Yeah. If you take those numbers, I mean, generally, I think we talked about these in some of my daily reports, is I think it's 7 times greater chance of getting COVID, period, if you're unvaccinated, 15 times greater chance of being hospitalized as an unvaccinated COVID positive, and 30 times greater chance of being put in the ICU if you're COVID positive unvaccinated as compared to vaccinated. So that's where you get into your percentages, Anthony, of 93% is being pulled from 20% of our population, right? So the program I want to talk about is something we started at Windsor Regional Hospital for all of our staff. And it has been very successful from this point of view. Is one of the things we recognized weeks ago is the fact that our staff, again, I keep saying that they're human beings in the sense that they do have lives outside of these walls, and they do have children who don't have access to vaccinations. They're under the age of 12 or 11, and they don't have access to vaccinations, but yet they possibly can, of course, catch COVID as a result and be carriers and bring it back to the household. And as we know, if you're in a house, even with someone who's under 12, you're not going to be wearing PPE with your under 12-year-old in the house. You're going to be with them. Even though you could be double vaccinated, of course, it's not 100% effective. So one of the things that we wanted to put into place was take advantage of the self-swabbing, the antigen testing that we actually were giving to staff who only had 1 dose or no doses previously. Give it to all the staff that want to use it. And there was a great response to that. We've had over 2,000 staff participate in this, and this has been going on for a few weeks. And again, we talked to even Weechu about this. One of the things we wanted to do is we're dealing with a high risk environment here. So how can we, and I have the cheese model here from the last board meeting, the Swiss cheese model, how can we reduce risk? How can we get the risk down? What things can we do as an organization to reduce the risks of our staff catching COVID, passing it on to other community members, patients, other staff, their own families, back to schools? How can we reduce that risk? How can we get that risk down, especially when they're dealing with immune compromised patients in a high risk environment? So if you look at this cheese model, we talked about the other day, the last board meeting, ventilation, air filtration. We talked about the carbon dioxide sensors in the various rooms here. that we've been using. So that's one of the ways. Vaccines, of course, talked about that a lot, but also this fast and sensitive testing and tracking. So by giving these kits out, we said to staff, use them as a surveillance purpose, recognizing that you're with young children who don't have access to vaccines, and or you're around elderly people. And so far already, since starting this, I call them saves, is we have 2 saves. And one was a rather dramatic save, is a staff member had their child. The child's not old enough to be vaccinated. The staff member used the antigen tests on the child, wasn't symptomatic, swab positive. What you're supposed to do if you swab positive with an antigen test is you're supposed to follow up with a PCR. They went, got the PCR for the child. Sure enough, the child was positive. But by getting early detection, this child in a household of children and parents was the only one who became positive. They were able to isolate the child properly from the rest of the family. No one else in the family caught it. The child did not go back to school and spread it more. The staff member did not come into the hospital and possibly, catch COVID him or herself and spread it in the hospital. So it was a save. And there's 2 almost identical stories like that in the hospital where staff have come forward. So this has been very successful from that point of view for staff to use it. And we're going to continue to do it on a regular basis as a surveillance method. Again, it's a Swiss cheese model, is things layer. In and of themselves, nothing in and of itself is perfect. You have to do all of these things in order to try to get risk down. And some, as stated, are personal responsibilities, some are shared responsibilities. And Dr. Saad, I think, talked about this at the last board meeting. So just wanted to highlight that we put this into place here with our staff, who of course work in a very high risk environment. And this, along with vaccines, along with CO2 monitoring, along with our regular ventilation and all the hand hygiene, PPE, et cetera, have been successful in reducing risk for our staff and community and patients. So I'll pass it over to Karen Riddell to give an update on how things are going at Puma and the other assessment center.
Great, thanks, David. So last month, we gave you an overview of our Puma clinic. So we opened up the Puma clinic August 31st in preparation for the school going back in. And based on what we were seeing in other jurisdictions and wanting to be able to divert patients from the emergency department that we were expecting to see from that perspective. And we had already started to see an increase in pediatric demand at our other assessment center. So since we've opened, as of today, we'll have seen over 2,200 children at our Puma Center. It's been very successful. And we've had good, quick access for parents. Typically, there's same-day appointments or next-day appointments available. Really helps fill any gaps in primary care access in the community and helps divert unnecessary visits from the emergency department. We've had very few transfers to the emergency department from the Puma Clinic. So our teams have done a great job in there, making sure kids are getting tested, getting any treatment that they need. And we're also offering follow-up appointments now. So for people that may not be able to follow up in the community with their family physicians, we will offer follow-up appointments in that clinic now. So we are expanding care based on the needs. We are starting to see within Ontario and across other jurisdictions and in other provinces such as Quebec, very high demand for pediatric respiratory illness, not necessarily COVID, but we are looking at a very bad season for RSV, and we believe the COVID-19 Assessment Center will really help with that in Windsor, Essex, so that we can get these kids seen. The symptoms are going to be the same as COVID, and that'll help us differentiate that and get them the adequate treatment. Our COVID-19 Assessment Center at the Olette site continues to be open 8 to 3, 7 days a week. We do primarily focus on 18 and over, but we will see children there as well, and we do see significant volumes of children at that clinic. And our Met Campus Puma Clinic is open 12 to 8, 7 days a week with a focus on 17 and under. Both clinics are by appointment only, and we do promote that. There is both online booking as well as a phone number that can be called. In addition, in the community, there are other symptomatic COVID testing available. So we have assessment centers with Med Labs of Windsor located in LaSalle, downtown Windsor, Leamington, and Tecumseh. And as well, we still do have Erie Shores does offer COVID-19 testing in Leamington. So lots of opportunities. Again, we want to promote early testing for symptoms. The quicker we can get people tested and get contact tracing done, the more that we can keep our numbers of transmissions down in the community and keep things under control and keep the kids in school and everybody else.
Yeah. And thanks, Karen. And what we're going to be doing tomorrow is announcing different hours for Puma for Sunday and Monday because of Thanksgiving, to make it a little easier for parents, recognizing that on those days, they're probably the majority of the children, of course, are home. So I think the hours are going to be 8 till.
I think we're running 8 to 3 on the holiday hours. Mm-hmm.
Yeah, for Sunday and Monday. So 8 to 3 on Sunday, just this Sunday, Monday, and then we go back. And you got to book online, so you'll see it online. And that'll pop online starting tomorrow. You'll see Sundays at the end of the day tomorrow. You'll see Sunday schedule. So that'll be a little bit different. But again, that's to accommodate maybe the holiday group. But what we're going to emphasize too today is all of the services are open over the holidays. We haven't been closed since Christmas, last Christmas. Is everything we've run has been open, meaning all assessment centers, vaccination centers, and Puma are open. So they're not closed on holiday, quote, Monday. Everything's open. You want to get vaccinated on Thanksgiving? That's a great day to do it, is go into Devonshire Mall between 8 a.m. and 3:15 p.m. and walk in and get vaccinated at the Devonshire Mall. And at the same time, if you need as an adult to get a COVID swab, the OLET AC is open as regularly scheduled. And as we stated, Puma will have different hours on Sunday, Monday, but open. It is not closed. So if your child is not feeling well, please take advantage of it. And same as an adult, don't wait for Tuesday to get swabbed. If you're not feeling well Sunday, go get swabbed Sunday. Don't wait till Tuesday. We've seen that historically, is our numbers over the weekends drop. And then Monday, it's like everything broke loose. Mm-hmm. It's been a pattern since the start of COVID. And so if you're not feeling well Saturday and Sunday, don't push it to Monday. Get your swab. The earlier you get the results, the better for yourself and your loved ones.
And literally, both the vaccine center and the COVID assessment centers, you're literally in and out in 30 minutes. So it's really a very short time period to get things taken care of.
Perfect. Thanks. Just a quick, Lori has her hand up. Lori, did you have a question?
Yes, I was just wondering, do you have any idea the number of children that have tested positive coming out of the Puma Center?
So the actual results are published by WeChew on their site. So all the historical data with regards to age groups and positive COVID would be reported on the WeChew website.
Thank you.
Yeah, we don't internally track that. WeChew does that in the sense that they get seen, we swab them, WeChew gets the results, they post them, and go from there.
That's great. Thank you. Other questions for David or the team? Seeing none. Thanks, David. Was that it for your report? Was there anything else? Sorry.
No, that's it, Mr. Chair. Thank you.
All right. Well, great job to you and your team. Keep up the good work. Next up, we have Dr. Larry Jacobs.
Thank you very much, Mr. Chair. I don't have a very long report today outside to say that the medical school has been back in person since September, and it has been going very well. Touch wood, all of our students are vaccinated on site, and all of our faculty and staff are also vaccinated. So we feel it was a safe wade back into the pool. It's going well so far. As you know, Western University is fully back on site as well. They've been boasting on their campus 99% fully vaccinated as well. So that's going to be a great case study to what university will look like in Ontario in a vaccine era. To this point, it's been, there's been hiccups with making sure people are keeping their masks on site, but from the cases perspective, I think things have been going quite well in London. But here in Windsor, for the Windsor campus for the medical school as well, fully vaccinated and back on site going well. I don't have anything else right now, but I'm happy to take questions if there are any.
Thanks, Dr. Jacobs. Any questions for Dr. Jacobs? Thank you. Next up, we'll have Penny Allen with the financial presentation, Treasurer's Report.
So I'll begin. First is about funding, and funding letters for 2021 to 22 were received in June, which is good news. Base increase awarded was 1.4% approximately, or 4.9 million. And funding for 2021 to 22 closely approximates the optimization review recommendations, which some of the folks here would not maybe know about the optimization, but it was a project that was done a few years ago to basically reduce some expenses, and it's really worked well, and it's a good news. And then funding for the 32 acute medicine and surgical beds and 5 acute mental health beds have been confirmed for the full fiscal year in the amount of 16.4 million, which is good. Funding is expected and has been accrued for 8 critical care beds. COVID-19 expenses reimbursement has been updated for the first and second quarter and is consistent with the last fiscal year. For the last 2 quarters, it is possible that only prescribed expenses will be funded. So that is the first one, okay. And then we have financial results, hospital operations. 4.8 million deficit for the hospital operations year to date. Salary and wage variance is due to COVID-19 expenses for screening the staff, visitors, operation of the assessment center, and the vaccine centers. Medical staff remuneration in a deficit, but this is funded through COVID-19 temporary physician funding, which is now being confirmed to end on September 2022 or offset the additional diagnosis revenues. Other supplies deficit due to referred out expenses for cataract procedures and the City of Windsor expenses for vaccination centers. So they're not right in the hospital. That's what they're saying, basically. Note that the unfunded COVID expenses and lost revenues total more than the year-to-date operating deficit, and those are the unfunded things. And lost revenues for things like parking charges, cafeteria that aren't operating, basically. Okay, next is the expenses, I believe. Yes, let's do that one. 6.9 million in the year to date in extraordinary expenses for which funding has not been received or confirmed. We have funding confirmation for expenses related to vaccination centers, nursing extern program, the COVID-19 assessment center, and temporary physician payments, and these revenues have been accrued to date. Accrued means you know that you're going to get the money because you have the paperwork for it, but you haven't quite got the money yet. So that's what that means. Okay, then the next one is for the revenue. Lost revenues, including volume-based funding, totals basically 5.7 million to date. And for the volume-based revenues identified and unearned funding may have to be returned at year end. Last year, the ministry allowed the hospitals to allocate unearned funding to the COVID-19 expenses. But maybe they're hoping that COVID's going to go away. I don't know. So we have to wait and see. Okay. Next is, just a second here. I'm going to get the rest of it. Hospitals have not received communication as to how or if any of these revenue losses will be funded in fiscal 2021-22. The Ontario Hospital Association has been asking hospitals to quantify lost revenues via surveys every 2 months, and we expect that there will be advocacy to have these losses funded once again, because they have been funded in the past. Similar to last fiscal year, we have recently received confirmation that the ministry will pay a premium on certain quality-based procedures when a certain volume threshold is met. This year, the premium is an additional 15% of the funding on the final 25% of the original funded volumes. Last year, it was 20% on volumes over 50%. So it's been cut back a bit, is basically compared to last year's fiscal year. And then we have there the base and one-time funding is 11.2 favorable. And of course, preferred accommodation and other recoveries are unfavorable year to date. We cannot charge for private and semi-private rooms if patients required them for infection control and prevention reasons. So that is very different than what was before COVID. Patient services are favorable due to the ministry covering uninsured patient services at the interprovincial rate. In the past, many of these accounts would have been uncollectible. So that's actually different and quite good. Also, in patient services revenue, diagnostic revenues exceed the budgeted amounts, but they are offset by a corresponding increase in the medical staff fees. And okay, yeah. And so now we're into the salaries and wages. That's 3.8 million unfavorable due to the additional COVID-19 expenses. The budget includes staffing expenses for additional 32 med-surg beds, 5 mental health beds, and 8 critical care beds. Employee benefits variance is in line with wages because a lot of the benefits like CPP and other things are tied to wages in certain ways. Additional med fees are either funded as they are COVID related or offset by diagnostic revenues. Med surge deficit is $694,000 to date. There is a surplus of $334,000 in the combined perioperative programs due to lower surgical volumes. Yeah, because of course surgeries have had to be postponed. However, this surplus is more than offset by the cost of increased PPE, which is the mask and that kind of things, I think. Incremental PPE will be funded for the first 2 quarters with pending guidance expected for the last 2 quarters of the fiscal year. The ministry is exploring options to offer additional PPE from the pandemic emergency stockpile at no cost to hospitals, which that would be good. Drugs are unfavorable to $984,000 to date. However, retail pharmacy revenues more than offset this deficit. So that's, again, very good news. Other supplies are unfavorable, mainly due to referred out expenses as outlined in the slides, like other supplies and cataract, that kind of thing. Yeah. And referred out cataract procedures and vaccination. Yeah. And the electricity rebate this is good news, has been extended to October 31st at 2022 at 18.9%. Previously, the rebate was 33.2%, so it's a lower percentage. But I think some of us really worried that they were going to not extend it at all. And so 18% is better than nothing. So this is good. And now we have the organizational health metrics. 6 and overtime at both campuses are over the benchmark. The 6 benchmark has been revised to 4.7% to reflect the additional 1.4 million added to the budget. And FTEs at the Met campus is up by 11.6 FTEs, full-time employees. And then there's for both, and OLET campus is also about 11.4. For both Met and OLET, FTEs would be favorable if not for those associated with screening, which are 24.6 at Met and 28.5 at OLET. FTEs for the assessment center are 36.5 and 103.9 for the vaccination center, totaling 140.4. And that is my report. And I would like to make a motion, if I could. I move that the financial report with the August 31st, 2021 results presented at the September 27, 2021 meeting be accepted.
Perfect. Thanks, Penny. Seconded by Ian McLeod. Questions or comments with regard to those minutes, or sorry, the overview or presentation?
Mm-hmm.
Oh, Patty.
Thank you, Mr. Chair. Just wondering, in the overall financial results, when they say the 6.9 has not yet been received or confirmed, does that mean we still have hope that there's dialogue, or is it just off the table?
Could I refer that to Mark Fathers? I don't know if they have hope or not, actually. Too
So
much.
generally, when we accrue any revenues, we have pretty good confidence that will actually be received.
Yes, yeah.
Okay, thank
And
you.
a lot of times accruals also mean that you know you're going to get it because you've had a letter or something from the ministry, but it's not cash yet. So
Right.
yeah.
Okay, it's just when we said not yet been received or confirmed, so we're anticipating
yes.
it's coming. Okay, thank you, Mark.
Okay, perfect. If there are no more questions, all in favor? Perfect. I don't think I saw anybody opposed. Wonderful. Thanks so much. Penny.
Yep. It's basically that the report, I'm just have to do a motion, that the report from the September 27, 2021 Finance, Audits, and Resources Committee be accepted. By that report, it means the minutes. So, yeah.
All right. Seconded by Dr. Freeman. Questions or comments with regards to that? Seeing none, all in favor? Perfect. Thank you so much. We have the correspondence and printed material there in tab E for your review. We have any questions or comments with regards to the board? Seeing none, I just have one item I forgot to bring up at the beginning of the meeting that can go under new business. I just wanted to say a big thank you to the province of Ontario, MPP Paul Calandra, the government House leader in the Ontario legislature, saying that our Windsor Regional Hospital is 100% going ahead. He also made it very clear that the Premier has made sure to let everybody know that this is going ahead. So again, thank you to our members of provincial parliament for all the hard work that you've done over the years. Thanks to David and his staff for moving this along. Thanks to Mr. Mayor Drew Dilkins. Without his support, this project may not have moved forward as well. So a big thank you to a number of people that are involved in this. This is great news for our community. Now we're just waiting for a letter.
Yeah, if I could just add.
And a check.
Yeah, and I just, since you went on about thanking, it's, Warden McNamara, all the county, it's all the county councils to, with their previous motions, supporting the location, supporting the new hospital, et cetera. You can go back to the raising the funds for the local share. But yeah, being, of course, mentioned in the provincial budget specifically, and then reaffirmed in the throne speech. And it was a very brief throne speech, but to be one of the highlights of the throne speech. And then MPP Calandra after confirming and saying this is proceeding. So we look forward to very shortly moving forward officially into stage 2, getting the monies to start that process. And we look forward to that happening in very short period of time. And as we recognize, everybody's been busy for the last little bit. So it's not for a lack of trying or a lack of commitment. It's been a little busy. So hopefully as we get into the fall and the winter, we find all those hours that we've been expending doing other things and are able to get this letter from the government to proceed and move forward. So we look forward to it. But I agree with Anthony. Mr. Chair, we have to say thank you, because that's a huge issue at a very difficult time for the government to specifically say, Windsor Essex, you're getting your hospitals 100%. Let's go. It's time to go. So thank you.
Perfect. Thanks, David. And just to add on to that, for anybody that's looking at donating, don't forget to contact Giselle Sagan in our Windsor Regional Hospital Foundation. She's waiting for your phone calls. She'd love to talk to you to set up some charitable activities, lifelong giving. So please remember to give the Windsor Regional Hospital Foundation a call at your earliest convenience. The date of our next meeting is Thursday, November 4th, 2021. Again, thanks everybody for all of your time. We really appreciate it. Can I get a motion to adjourn? We have Paul Lachance, seconded by Genevieve Eshok. Thank you. Penny?
Yeah,
Yes,
just
Penny.
a question. It's early. It's not 6 o'clock or not. So what time should we try to go to the second?
Sorry for everybody. It's 6:15. I have a feeling that this may be a longer than average media scrum.
Okay, that's good.
So 6:15, everybody. If you want to be there 5 minutes early, that would be great. I'm sure Matt will have us ready to go in a few minutes early if we just want to talk. So again, and sorry, I didn't make the motion to adjourn. All in favor of adjourning the meeting? Perfect. Thank you. See everybody at 6:15.